And tell me about your treatment a little bit, and you touched on that, is that you went, what was your treatment? So you had breast removal, you had a
Correct.
mastectomy, you had lymph node dissection. By sentinel node, you meant they went and put a
Correct.
dye, they found the lymph node, they took it out. How many
Correct.
lymph nodes did you have which had cancer in them?
4.
4 lymph nodes. And then, so were you recommended chemotherapy followed by
Yes.
something? And what was that journey like?
I had the aeromycin, Cytoxin, and the Taxotere.
Adriamycin is also called the red devil, just because of the way it looks.
Well, I would say the Taxotere then is a dose-dense. Taxotere would be the nemesis cousin.
Okay.
Because I don't even know if it's even given anymore or in that fashion every other week. In fact, me and my chemo buddy, who I'd never met before in my life, but to this day has become one of my dearest friends, they didn't even know in New Hampshire what the side effects would be on a dose-dense level, and they were brutal. But again, I went to work every day and I got through it because that's what you do when you want to live.
That's amazing. Tell me about this. I'm intrigued about this chemo buddy. I found a lot of patients, when they're sitting around in the chemo chairs and everything, they kind of form friends and form relationships, and they talk about the diagnosis, talk about like support groups. So tell me a little bit about your chemo buddy.
Well, my oncologist, Dr. Gautami Rao, called me and said, you do have an aggressive breast cancer, and so does another one of my patients. With your permission and hers, I'm going to try this dose-dense Taxotere on both of you. And I'd like
So it's truly your chemo buddy. It's truly you guys were getting the same chemo.
She says, I'm going to have you both come in my office, meet each other. She's going to go 2 weeks before you, starting her course of treatment. And so you can call each other. And also, the nursing staff here would like to take notes because you are literally the first 2 people that have ever taken it in this facility. And so I felt like a happy, privileged, but nervous guinea pig.
And he got through it. Tell me a little bit about aromatase inhibitors. How were you introduced to
You
that?
a little bit? I'm going to tell you a lot.
And we'll go through the whole journey because you've had a very interesting journey and something which can be very educational to our listeners. But first, just tell me about how were you introduced to aromatase inhibitors?
Well, my doctor said to me, because there was the tamoxifen question, which had been the gold standard previously. Remember, we're still in 2003. And then she said, you could try an aromatase inhibitor. It's a fancy word for an estrogen blocker or neutralizer, but there's a catch. Always is, isn't there? The catch is you're young, you're 45, you're not fully into menopause yet, and but it has extreme promise for prevention of recurrence. But you would have to have your ovaries removed because you need to be postmenopausal.
That's a big decision. It's a big, big decision.
I said, hand me a knife.
Hand somebody else a knife. That's
or should
actually,
I say scalpel?
Yeah, scalpel. so
because, again,
did you take time to think?
What's the decision? It's a no-brainer. Do you want to live or not?
But did you, you do research and you thought about it, like the first time you went and took a second opinion. Did you think about it a long time? Because removing your ovaries can have, other side effects and things. Did you pause and think about it and say, okay, I weigh the risks and the benefits?
That first night was hell.
Just after the removal of the ovaries?
Instant menopause.
Right.
You're a guy. You don't maybe quite get it, but women listening who've been through that, I mean, it comes on slowly in the natural course.
Right.
You know that.
Yes.
Bam.
Bam.
One
it's
night.
like falling off a cliff almost, a hormonal cliff.
It was.
And then how did you what did you do to get over it? Like slowly, how did you adjust to it? Or there's no adjusting. It's just you just say, okay, I'm going to suck it up and go with it.
I sucked it up, but I think I was lucky because after something like a year and a half, the hot flashes diminished over time. But then, as in is one part of your questions I'm sure is going to come up, exercise. Oh, that played such, I think, an important role in my survival, in my emotional stability, changed my life. I mean, I went from a couch potato, no doubt about it. I went from a couch potato to an Olympic star.
So you went through therapy, which was surgery, chemotherapy, and then after that you had, your ovaries removed, aromatase inhibitors.
So I was on the aromatase for 5 years.
5 years.
And, I knew, I was well aware of the side effects, the joint issue, et cetera, the joint problems. And yes, I did feel like I was perhaps, arthritic before my time. But nonetheless, I weathered through that. And then my doctor said, but wait a minute, there's going to be you did so well with the aromatase inhibitor, and we now are thinking it's the gold standard for adjuvant care. What would you think about going into a 5-year additional study? They're thinking if it works well for 5 years, maybe it'll work well for 10 years.
And what were your thoughts at that time?
For women like
Bring
you.
me the scalpel?
No, what I thought then was, I felt like this was my obligation. When you're told you only have 3 years to live, and now it's 5 years. Amazing, Carolyn. Now it's 5 years. I'm like, I need to do this. I need to do this for my daughters. I need to do this for future generations. I felt you feel a moral obligation to humanity to be a part of something like that. And it was blind, double blind, but I really thought I really was on the drug because it still had the same side effects. So they're never going to tell me. I bribed them, but
they're probably never going to tell anyone.
But I really do think I was on it.
Tell me a little bit about, you said you had one breast removed and then you chose to have the second breast removed. Tell me a little bit about that.
Well, it did begin, I was very large-chested, like D cup, and it began to feel like an appendage at times when I was exercising and such. And because now you're wearing a prosthetic that weighs a lot to match the other side. And my illusions before the show, when I was talking to you about Homer's Odyssey and stuff, I felt like a cyclops boob. So I went to my oncologist and I said, what if I have my other breast reduced? And she said, I got a better idea. Why don't you have it removed?
So it is more for...
And I said, that's the best news I've heard all day. And she wrote a prescription, and I had it approved by my insurance, and I've been flat and fabulous ever since.
Flat and fab, that's amazing. So you've traveled widely, and you've probably met a lot of other survivors. Do you think that's something which more survivors are doing?
Yes, I do.
Flat and fabulous?
You can go to the Flat and Fabulous Facebook page and join it if you're accepted into the group. I think there's something like 1,500 members now. A lot of people are of the mind that even if you have reconstruction, they're not satisfied. They're afraid that they themselves will become, they're a little, jaded or whatever about having the insertions.
So you're saying the movement is picking up steam.